Dr. O'Keefe Simmons, welcome back to Inside South Florida.
Thank you so much. Thanks for having me again.
It's great having you. We learned so much from you.
Thank you.
What are some procedures that don't require surgery for weight loss?
This is a good question. There are a lot of people who aren't familiar with this. So there are procedures that are done where I'm able to go in through the mouth to access the stomach. And the most common of those types of procedures that are done in the United States include the endoscopic sleeve gastroplasty, which is just suturing within the stomach, the intragastric balloon placement, which is the placement of a balloon for a few months in the stomach and then it's removed. And there's also revision for patients who've had bariatric surgery and regained weight. We're able to basically close things that may have dilated in the digestive tract.
Wow, sounds very scientific.
Yeah.
But easy for you to say.
Yes.
And where does this fit into the picture of weight loss options?
Yes, there's so many weight loss options available for patients that they're more familiar with when it comes to bariatric surgery and the medications, especially more recently as these medications have become more popular. And with these endoscopic procedures, it gives patients an option to have a procedure done without the risk of surgery. So if they're afraid of the risk of surgery or maybe not a candidate for a surgery, this offers an option with less risk than surgery. Whereas with the medications, some patients don't want to be on medications lifelong. There may be interactions with other medications. So this gives them an option to have a procedure that's low risk, that's a one-time sort of deal to help address their weight issues.
Right, and non-surgical just seems like the way to go.
Exactly for some patients.
Absolutely, and who are the candidates for this?
Yeah, so generally the BMI, which is a broad metric used to classify patients based off their height and their weight, the BMI criteria is about 30 to 50. And for more information on BMI, we have a calculator on our website that helps to clarify it because it's one of those medical things that some people aren't that familiar with. But based off your height and your weight, there's a criteria of 30 to 50. And I think in general, and we're talking about the characteristics of the patient, there's really important that the patient has an understanding that these procedures are tools, right? They're tools to help with weight loss, and it's not necessarily a magic fix. So it's important that the patient has an understanding that these procedures have to accompany things like lifestyle changes. So the diet part, the exercise, mindful eating, all these practices that have to accompany the procedure to have long-term sustained weight loss. And our office is really big on emphasizing those facets that have to be optimized.
Thank you for all that information. And to follow you or find you at your practice, where could our viewers go?
Yeah, so for my practice, you can go to www.simmonsweightloss.com. We're also on social media. So Dr. Weight Loss 305 and on TikTok, Dr. Weight Loss 305 as well. So if you want to call 305-204-8558, happy to answer any questions that you may have.
I love it. Well, thank you again for joining us on Inside South Florida.
Of course. Thank you so much for having me. It was my pleasure.